So in this video, I'm gonna share around 8 to 10 medication name that is very famous, and there are high chances that you will see on your Nclex exam. So I'm not gonna share a deep details with you, but I'm gonna share only main bullet points that is good enough for you to know what this medication is used for, right? So let's start. So the first medication that there are high chances that you will see on the exam is digoxin. So only the thing I'm gonna share with you. So when you're giving this medication, two things you need to remember. First thing, that the nurse is going to check apical pulse for 1 full minute, apical pulse one for full minute. And if the apical pulse is less than 60, then you are going to hold this medication. That's all. Digoxin, check apical pulse for 1 minute and hold the medication if heartbeat less than 60. That's it. Next medication, furosemide, also known as Lasix. This medication will tell your kidney to dump excessive amount of fluid in your body. So those patients who have excessive swelling because of heart failure, this medication will release the lot of fluids from the body. Through patient will urinate a lot, and when patient will urinate, not only losing lot of salt and electrolytes, but also the main thing you need to know that you have to monitor for potassium level. You have to monitor for potassium level. Remember that K plus K, I mean potassium symbol is K, right? So when you're giving this medication, you are monitor for potassium level or labs. If the potassium is below some ranges, then you have to hold and let the doctor know, right? Also, you don't give this medication if patient is already dehydrated, because this medication job is to release excessive amount of fluid from your body. So if the patient is already dehydrated, that's mean this medication will, like, patient will release more fluids. So patient need fluid, right? So you are holding that medication at that time. So remember that furosemide. Also, if the heartbeat is less than 60, then you also hold furosemide. That is also used for blood pressure. Next thing, next medication, metoprolol. So metoprolol is a blood pressure medication. Any medication that names end with LOL, as you can see, metoprolol, right? LOL, metoprolol, carvedilol, propranolol, all those, they are given for hypertension. So the thing you need to know, if the blood pressure is less than 100 or heartbeat is less than 60, then you're gonna hold metoprolol. You have to remember that. If heartbeat is less than 60 or blood pressure less than 100, you have to hold this medication. Why you have to hold it? Because if the blood pressure is already less than 100 and you give this medication, it's gonna drop more deadly. So that's why you have to hold metoprolol. That's the third famous medication. Fourth famous medication, there are high chances that you will see nitroglycerin. Nitroglycerin is given through sublingual and some other forms. But the main thing that you need to know is, you have to teach the patient that when you get up from the bed, you have to get up slowly. Just remember the fall precaution. You have to tell the patient to get up slowly, because the patient will feel dizziness, because this medication gonna also drop the blood pressure. So that's why main thing is, tell the patient to get up slowly. That's what you have to remember for nitroglycerin. Talking about insulin. So when you are giving insulin, if the sugar level is less than 70, then you have to hold their regular insulin, right? Also, another important thing is, any insulin that has log, like Novolog, Humalog, Aspart, they are fast acting insulin. So the best time to give this medication is when the patient meal tray is present, or if meal tray is not present in the option, then you're gonna choose give 15 minutes prior meal. Or if that option is not available, the second option you will see, the patient meal tray just arrived, and then you can administer the fast acting insulin. So that's the important thing to know. Another important medication, when you are giving heparin, you have to monitor APTT lab value or PTT lab value, both are same. And the patient, you have to risk for bleeding. That's the important thing to know. But if you're giving warfarin, you have to monitor their INR lab value. INR should be in between 2 to 3. And also risk for bleeding you have to monitor. So those are the important bullet points and medication that you need to know. Another medication is metformin. You have to hold metformin 48 hours before any CT scan of IV contrast. in that time you're gonna hold this medication. Also, if EGFR is less than 30, based on different policy and protocol, but mostly that would be your answer. Hold this 48 hour prior any CT scan or surgery. So those are the medication that I want to share. I did not share very deep details, but that's the basic surface information that I share with you. So after that, when you see, you will have some idea that if you see question about metoprolol, which teaching you have to give it to the patient. So patient says my heartbeat is 55 and I'm gonna take this medication. That would be wrong answer, because you have to hold this medication if heartbeat is less than 60 or blood pressure is less than 100, right? So I hope watch this video one more time and write down your notes. Hopefully this medication help you a little bit. Okay, good luck.